mostly to use the aerobic system, so just using up what oxygen is left in there. The next 3 sets of 15 are going to be all anaerobic. So if you think, so a lot of research has looked at, say you have ACLs post-op, you follow them for a year. When you look at the concentration of slow twitch versus fast twitch, they're saying that unfortunately they have more slow twitch concentration than you would like to see. And this, based on it being aerobic or anaerobic, is going to target that fast twitch system. And so
I don't even know how many I'm doing in the last track.
30. So usually it doesn't count for you. That's one of the downsides. So usually it's about 1840 as far as the time that it takes to do it. And then
this is getting hard, Laura.
This is still the beginning.
That's not good.
This is the warm-up set. So 50 pounds, it's a lot.
Trust me, patience, I'm in shape.
So I mean, you can just do this with quad sets, and they've even done some research studies looking at disuse atrophy or just atrophy in the first 2 weeks afterwards, and they've seen what if we just hook this up and do nothing. And
I'm
even 5 rounds.
definitely not.
Okay. All right. So 30 seconds of downtime, and then we're gonna do 3 more sets of 15.
Yay.
Do you want me to lower the weight a little bit?
No.
Okay. This is the athlete in going. This sucks, but don't even think about it. So there's a hashtag that's earn your deflate, and so the hashtag.
Does the pain I'm gonna get at the end of this reduce when you take off the tourniquet?
Yes, pretty immediate.
It's the best feeling.
So the cool thing is, so
I might do it just
go
for
ahead and
release.
go.
What are we doing?
15. So 3 more sets of 15, and then there's always going to be a 30-second break between the sets of 15. So with the 3 sets of 15, now this is going to be quite anaerobic, and so that lactic acid burn that you think about when you lift heavy is what you should be feeling right now. Seems like you're right at that point. So 1750 roughly, so you'll go again at 1720.
Gotta get a picture of his face.
No. Just stay.
Yes. Dude, right up there.
I'm very transparent about it when patients ask, like, will my leg turn color? I'll just tell it before they even ask. Your leg's going to turn a little bit of a different color. It's going to turn a little purplish. You're going to have a little bit of swelling. You actually see increased self-swelling in the quads themselves when they do this.
Perfect, that's what I want.
Yeah, you get a little swole, get that VMO teardrop
I
going.
cheated, they cheated.
Oh, sorry.
Too long of a break.
Yeah.
Oh, you just went 2 seconds over.
Yeah, okay.
And so, at very low levels, you're going to have huge quad burn.
We're great.
And the cool part is, so if you compare this to a normal workout, lifting at 80%, you're going to have a lot more muscle trauma, micro trauma. And with this, there's a lot less delayed onset muscle soreness. So with the Fire, for instance, if they have a game on Saturday, we don't mind putting them through this workout on Saturday or on 2 days before. We still don't do it the day before. I think there's more of a mental component to that, but usually there's minimal soreness the next day, especially once they've done it a few times.
Patients stop listening to you because they're too tired?
Yes. Tell me what I just told you.
This is very difficult.
Yeah.
I'm not faking it.
Yeah. I have to tell them the 40 and 3 sets of 15 about 14 times during this.
Holy cow.
And Laurie, we can do it with your arms if you want to see what it's like for an arm.
Laura's done
And I like to do, do the same weight. So for instance,
I'll do an arm too.
Yep.
Let's do an arm.
Cool. And so we'll give you 5 pounds with each, and you can do your own little.
Oh, that is a really bad. Just restart again.
Evan, you've another one that did it. Shane No had his fellow do it.
Of course.
Is it Austin?
Yeah.
Yeah, Austin.
He's in Kentucky now.
Yeah. And then who's the guy that went to Winston?
You're good at this. You can just keep talking while I'm being punished.
Exactly. There's one that went to North Carolina. He made it in one right before you, actually.
I think.
That's it, right?
All right, I'm done.
All right. You got all the photos, all the video that you need?